First, you will be introducing yourself. So, I am Sean Gabriel Flores, and I'm going to be your physical therapist for this afternoon. So, uh, first of all, we should always take note that the patient is an acute patient. So, we'll be doing our exercises and our treatments with the utmost care. Now, for our treatments for pain includes PJM using grade 1 Calton-Born distraction, PJM using grade 2 Maitland on the right hip towards posterior and anterior glide. This is to decrease pain and then we'll be doing a series of muscle setting exercises towards the right hip flexors, right hip abductors, adductors, and extensors. This promotes blood flow in the muscles and could also help in reducing pain. After that, we'll be doing a series of assisted active range of motion so that it is also one of the most important things that the patient should do, that the patient should always do ROM even at home. So for the treatment, we will be assisting the patient first so that he would be or she would be familiar with the planes of the ROM. If the patient can do ROM without assistance, the patient could also do that so that it could help increase the patient's ROM. Next, we'll be addressing or we'll be maintaining the patient's ROM. So will help the patient have an increase in ROM. So PJM 3 Maitland, this will help increase ROM. Then next, we're going to be doing mobilization with movement. It could help improve joint tracking and pain-free motion. So let us just assume that I am using an assistive device, a belt, or anything that could help me with applying an inferior lateral glide. So also, we will like to assume that I am using a splint, that I am able to perform this with proper body mechanics. And then next is we're going to be applying manual stretching techniques. Also, these manual stretching techniques will help the patient have an increased ROM. Okay, so always be extra careful when treating patients with acute phase because we don't want to exacerbate the pain. Before starting with our treatment, we would also like to check for the ROM of the patient, the vital signs of the patient, and the sensation if it's intact, and also test for the DTR. Next is our proprioception retraining. So we are going to be explaining to the patient the stresses of weight bearing and other activities. Also, we should make sure that the patient does not have excessive weight bearing when he or she is ambulating. Next, we'll be doing multiple angle isometric techniques for the patient. This is to strengthen the patient without eliciting too much pain. Always remember that pain is the guide. Okay. Next, we'll be doing open chain exercises. Always make sure that the hip does not compensate with the movement of the femur. We will be doing open chain exercises so that we do not place much force on the hip.
1, 2, 3, go. Okay, that's good already.
Also, we would like to educate the patient that and teach them safe ambulatory patterns as part of their home exercise program. For HEP, teach the patient how the stresses of the weight-bearing other activities impact the joint, teach the patient how to ambulate safely, and also help the patient provide them with assistive devices for ambulation. Also, don't forget for your aftercare.